we want to get back to Under the Gold Dome. Tony West is here with me for Americans for Prosperity Georgia, and of course, it's kind of committee hearings today, and they're getting ready to be through next week. I think next Thursday is Sine Die, and so there's a lot going on under the Gold Dome. Tony, why don't you give us an update?
Hey, good morning, Martha. Yeah, it's been several weeks since we've talked about it, but there was some action taken on Certificate of Need yesterday. The Senate Regulated Industries Committee passed their committee substitute for House Bill 1339 and made some, from our point of view, some improvements to it in reforming the Certificate of Need program. I know we've talked about it, so regular listeners may know exactly what I'm talking about, but if you're hearing of it for the first time, a Certificate of Need is just a government permission slip that healthcare providers must obtain before they can provide new services or expand existing services. And then unelected bureaucrats determine if there is a need for that service in that community, and existing nearby providers lobby those bureaucrats to deny the certificate to avoid that new competition. And we've been advocating for its elimination. It doesn't look like we'll get that far this year, but like I said, certainly some progress made yesterday.
So, I know this is a much bigger question, but I listened to part of that Tucker Carlson interview yesterday where he talked a lot about free markets and capitalism, and they'll be continuing it today. And, he's an interesting guy that has a lot of ideas, but his points about capitalism and free markets are true, because in healthcare, we don't have free markets. In other areas, we don't have free markets because of the kind of overregulation of them. How do we get back there? Because people I've been working with AFP for years. They're a great free market organization, but how do we get back there to where we have true capitalism and free markets?
Well, at the grassroots level, we have to keep talking about it.
Right.
We have to keep talking to our lawmakers and educating our fellow citizens to also do the same, because the incentives within government is to pick and choose winners and losers and distort the market, and act like you're creating value in a segment of the economy when really you're just messing up markets all over the place. And then we turn and wonder why the quality of things and the prices go up. That's kind of what we talk about with Certificate of Need. The way you fix healthcare is not more government intervention. It's allowing market forces and allowing free people to make decisions and serve one another in healthcare, instead of sticking with a regime like Certificate of Need that's 50, 60 years old that isn't solving any problems, exacerbating them.
Well, and I think to take it a step further, one of the sad things, and I know this is a more philosophical conversation, Tony, but I think it's an important one, is that, ACA did in fact insure more people, but the costs have doubled. And so it hasn't saved any money. And it makes your point, actually, that more government intervention makes prices go up, not go down. All you got to do is look at the pharmaceutical market, because, we have the highest prices in the world in America because there are fixed prices everywhere else. And if you have fixed prices, then, you got to get your profit somewhere. So it is a mess right now, and especially in healthcare. And then I think the biggest lie people tell is that if you don't have insurance, you can't go to the doctor, because most hospitals, healthcare, whatever, they have some kind of way to provide services. You just have to ask for it. So it's a challenge, but I think healthcare, since it's becoming a bigger and bigger portion of what we spend our money on, it's becoming more and more important.
Yeah, and I don't want to diminish the complexity of the system. That's what we heard in committee yesterday. Lawmakers, especially the chairman, recognized the problems with CON, but also acknowledged the complexity of the system. So as we move away from a government-centric, complex system more towards a person-centered approach to healthcare, it will take time. Each step at a time, moving towards a free marketplace in healthcare is going to reap rewards, but we know it'll be one step at a time, because it's been one step at a time in the other direction for so long. It's very rare to be able to make huge progress in one fell swoop in government. But like the bill yesterday did make some progress. It would allow new hospitals to open in rural counties. A rural county is 50,000 or fewer people in that county. Some reforms for surgery centers, um, imaging centers, or I'm sorry, imaging equipment being purchased by like physicians' offices. Um, Psychiatric and substance abuse facilities now no longer need a con, so hopefully we'll see more of those open up because of the mental health crisis and drug abuse crisis we're facing. And then we're also excited about the ability for birth centers to open without a con. We know that there's been a discussion of maternal and infant health across party lines in Georgia this year, and we've been advocating one way to help get people or get women and mothers to be more access to care is get rid of con and allow birth centers to open. So we're excited to see that.
Well, obviously, every state has to follow federal law, right? But there are some states that do better than other states. Does AFP rank the states as far as who's the most free market or the most capitalistic as far as a state is concerned?
We don't have an internal ranking system. I know that a lot of those exist. I think Georgia excels in some rankings, is a little bit more middling in others. But with healthcare and con specifically, what we keep trying to educate people on is states as diverse as California, South Carolina, Florida have gotten rid of con, sometimes for years and years. In some ways, they outrank us on some of the healthcare metrics that everybody agrees are a good way to look at how healthy of a state you are. So that's why it's not a silver bullet. Getting rid of certificate of need would actually empower healthcare providers and patients to seek out the treatment that's going to help them the best. And there's no way that we can get to the place we want to be as a state when it comes to healthcare if certificate of need is in place. So for the long term, we are definitely calling for a full repeal of that.
So, what else are you working on for this session? Because the school choice discussion's been kind of quiet.
It's been quiet, but things are afoot. I mean, we only have two. There's only really 2 more weeks of session left. So it's got to happen soon. Our champions under the Gold Dome for education choice are working hard. Outside organizations like Americans for Prosperity, we are working hard to educate the lawmakers who had concerns last year about the bill. And I'm optimistic that we'll be able to get it done, because if we don't, it will look very poorly of Georgia when all of our southeastern neighbors and even states across the country are embracing school choice, sometimes at a greater extent than what we're even talking about now. So it's one of those things where I think everyone agrees it has to get done, and it's just a matter of dotting the I's and crossing the T's on what the bill will actually look like.
Well, Tony West, we appreciate you being with us today and keeping us updated on what's happening under the Gold Dome. Thank you so much.
Thanks, Martha.
Thank you.